Hi, my name is Dr. Laratta. I am a respirologist and sleep subspecialist at the University of Alberta Hospital and Alberta Health Services. So many Albertans suffer from obstructive sleep apnea. It's a very common disorder in Canada. Obstructive sleep apnea is a disease where you have recurrent and repetitive narrowing of the upper airway during sleep. What this leads to is sleep fragmentation and decreases in the oxygen saturation in the blood, and this can lead to poor quality of sleep. So this is a model that contains a look at the upper airway, which is where the disease in obstructive sleep apnea manifests. So up here is the pharynx and the posterior oropharynx, and that's what narrows or collapses during sleep, which prevents airflow from the mouth or the nose to get into the trachea. The disease that occurs here is impacted by weight because that can narrow the upper airway, but it's also impacted by the structures that are present around that area, as well as the activation of the pharyngeal dilator muscles, which are the muscles that keep this part of the airway open during wakefulness or sleep. Obstructive sleep apnea is a very common condition affecting about 15 to 20% of men and 5 to 10% of women, estimated. In Canada, a recent survey suggested this was 26% of the population had at least some symptoms or risk factors for obstructive sleep apnea. So symptoms of obstructive sleep apnea include snoring, awakenings during sleep. You might go to the washroom frequently during the night. You might awaken snorting, choking, or gasping. Some people awaken unrefreshed or with headaches in the morning, and many people describe fatigue during the daytime or sleepiness. Some people with obstructive sleep apnea, even with mild disease, have many symptoms. Some people with severe disease, at least in terms of how we currently define severe disease, don't have many symptoms. So the severity of sleep apnea does not always correlate with the symptom burden that people experience. Other symptoms of obstructive sleep apnea can include mood changes, cognitive changes, or changes in your sexual function. Some of my patients' first cues that they might have obstructive sleep apnea is when a nurse or a healthcare provider or a friend or a family member comments that they might have pauses in their breathing during sleep, or their breathing is irregular or not normal during sleep, and that actually prompts a number of assessments or referrals to our clinic. So the first thing would always be to talk to a healthcare provider that you trust. That could be your family physician for many patients, and they can direct you accordingly. You can access care at sleep centers. So in Alberta, there are 3 main sleep centers. The first is the University of Alberta Hospital Sleep Disorders Program, which is where I work in Edmonton. The second is at the Sleep Center at the Foothills Medical Center in Calgary, and the third is at the Sleep Clinic in Lethbridge. Obstructive sleep apnea cannot be diagnosed based upon physical examination or history alone. You really need physiologic testing. In Alberta, that comes from 2 main types of sleep testing. The first is ambulatory sleep testing or home sleep apnea testing. What this is the person who is worried about sleep apnea will pick up the equipment, bring it to their home, apply it, wear it for 1 or 2 nights, and bring the equipment back to be interpreted. Most common setup for these home sleep tests include a little finger probe where it checks your oxygen saturation and your heart rate, a band around the chest that monitors your effort to breathe, and then a little cannula or a little sensor under the nose that monitors the airflow that is occurring during sleep. There are several types of home sleep testing though, so don't be surprised if the setup is slightly different. So level 1 polysomnography is the gold standard test to diagnose obstructive sleep apnea. There are some limitations because you have to access a specialized sleep center to get this testing, as well as there are wait times for this testing in Alberta. It is a very good test though for diagnosing sleep apnea that is not picked up on home sleep testing, for diagnosing other sleep problems other than obstructive sleep apnea. When you get this testing, you go to the sleep lab on the night of your study. You'll meet a sleep technologist who will hook you up to a number of monitors. This includes monitors over the head to monitor your brainwaves during sleep, monitors around the eyes, the chin, sometimes the arms, but also the legs to monitor muscle activity, bands around the chest and the abdomen, a heart probe, a finger probe, and then there's an infrared camera on you during your sleep to look for funny behaviors during sleep. The sleep technologist is there to help make sure that the data that we get is of high quality, to ensure your comfort during the sleep test, and also to apply a treatment during the night of testing if significant sleep disordered breathing is seen. The report, though, does outline if you have obstructive sleep apnea and what the suspected severity of sleep apnea is. While mild obstructive sleep apnea is associated with many symptoms, a lot of the conditions that we worry about that are associated with obstructive sleep apnea are most common when you have moderate to severe obstructive sleep apnea. So the associated conditions include things like heart disease, heart failure, heart rhythm problems, strokes, high blood pressure, poor glycemic control, to name a few. The reasons why obstructive sleep apnea is associated with these conditions is thought to be related to the fight or flight response that is generated when you're trying to breathe against a closed upper airway, systemic inflammation, which is brought on when you have rapid desaturations followed by reoxygenation, so rapid changes in the oxygen content in the blood, the amount of time one spends with a low oxygen saturation during sleep, to name a few of the possible mechanisms. There's a lot of work ongoing to help understand the pathways that lead to the systemic conditions that are associated with obstructive sleep apnea so that we can start to intervene on them. However, at this time, it's not clear that once you have obstructive sleep apnea and you have established heart disease or strokes, that we can prevent further strokes or heart disease from occurring from treatment of obstructive sleep apnea alone. First-line treatment in severe obstructive sleep apnea is continuous positive airway pressure therapy, or CPAP therapy. This is where a gentle pressure of air is applied to your upper airway through a mask from a device that sits at your bedside. When you're deciding to use this device, the most important part of the setup is actually the mask fit, because this is how you interact with the machine that's at the bedside. So ensuring that you have a mask that you feel comfortable with wearing and that you feel confident in that you can fall asleep is the most important part of getting fitted for a CPAP device. CPAP has been shown in really high quality studies to reduce sleepiness, resolve the obstruction of the upper airway during sleep, improve your daytime symptoms and sleep-related quality of life, reduce your blood pressure, and reduce the risk of getting in a motor vehicle accident. About a third of people, though, take several weeks to get used to CPAP, so they have to spend some time kind of getting used to using this mask during sleep, adjust some of the settings to make it work well for them. And then they start to notice the benefits to their quality of life and to their overall feeling of being refreshed in the morning. So I would encourage everyone who is prescribed this by a healthcare professional to give it a try for at least a few weeks in order to see if you fall in that 1/3 of people who grow to like it after they're able to use the device. If you have a diagnosis of obstructive sleep apnea, you're at higher risk of getting in motor vehicle accidents or having a workplace injury. It is really important that if you have this diagnosis that you take extra precautions in environments where you are operating heavy equipment or a motor vehicle or where alertness is required. For professional drivers or people who have professional licenses, they also have to alert their appropriate governing bodies, such as the Ministry of Transportation, that they have this diagnosis so that the appropriate protocols can be followed. So in general, alcohol can also worsen obstructive sleep apnea, so especially if you're untreated or if you're experiencing sleepiness, then avoidance of alcohol or minimizing the use is an important part of care. It's important to recognize that sedatives will also increase your sleepiness and fatigue, and to be cognizant of that. If you have mild to moderate obstructive sleep apnea, there are other options than CPAP as first-line treatment therapy. One of the most effective and well-liked devices is called a mandibular advancement device or a dental appliance. If these are designed by a sleep-trained dentist who does a custom-fitted device that basically advances the lower jaw forward, this can be a very effective way to treat obstructive sleep apnea. It does take several months to titrate though, and you usually do require repeat sleep testing after the device has been made in order to ensure that it's actually done its job and it does resolve the sleep apnea. There are other alternatives beyond CPAP and dental appliances, particularly if you don't tolerate those devices or if you have mild or moderate disease, and these can be discussed with your healthcare provider. While obstructive sleep apnea is known as a weight-related illness, that's not always the case. For the large majority of people, an elevated weight will contribute to obstructive sleep apnea, but I do have patients who have a normal weight and have the diagnosis because of other mechanisms that can lead to obstructive sleep apnea. If you have an elevated weight and you have a diagnosis of obstructive sleep apnea, it's really important to think about weight loss, exercise, and good healthy nutrition as part of your care plan when addressing obstructive sleep apnea. This may involve exercise prescriptions, dietitian visits, and a multidisciplinary approach. It's also really important to think about other options like bariatric surgery or using medications that can help you lose weight if they're available to you and covered by your insurance. So there's a lot of great information online, very reputable organizations. The Canadian Sleep Society and the Canadian Sleep and Circadian Network both have great websites that you can review as just some examples within Canada. There's also a lot of patient resources on the American Academy of Sleep Medicine website to access to help you navigate some of these diagnoses. Thank you, Albertans, that have watched this little clip. I hope you've taken something from this that was useful to you. I really encourage you that if you're worried about obstructive sleep apnea or if your partner is, that you talk to a trusted healthcare provider about this possibility. I know that there are great team members available in the community to help you with this. And if you need us as a sleep subspecialist in this province, I know that we're all very excited to see you and to talk to you about how to improve your health. So thank you.